Okay, so the next test parameter that we're going to discuss, we have here the glucose. Okay, so increased blood glucose here may be eventually because of the problem with the hormone production. So there are different hormones which try to regulate the level of the glucose in our body. One of that is your insulin. So insulin tend to decrease our glucose level. However, other hormones like your glucagon, cortisol, epinephrine, growth hormone, and we have also your thyroid hormone, thyroxine, T3 and T4, tend to increase your glucose level. Okay, so the increased blood glucose level in our body could be attributed here because of the presence of your diabetes mellitus. And diabetes mellitus here characterized by the decreased production of your insulin. So insulin again is produced by the beta cells of our islets of the Langerhans of our pancreas. And the insulin served here as a transport vehicle here that try to transport vehicle that try to transport your glucose from your plasma, okay, going to your, so again, if this one is your blood, you have here your cells here, so your glucose will be transported here inside your cell by means of your insulin. So pag wala tayong insulin, walang magta-transport ng glucose natin papasok sa cell natin. And therefore, we could not utilize the glucose even if you have much of the glucose in your plasma. And therefore, that results here to your diabetes mellitus. And therefore, what you have here, very high level of the glucose in the blood. So as the blood here contains a very high glucose because you have a decreased insulin production in the case of your diabetes mellitus, the blood that would be carried here by your okay, that's being pumped to your kidney by your heart here contains a high concentration of your glucose. And after that one, your glucose here will be filtered by your glomerulus, diba? So, however here, some of the glucose, okay, so that would eventually go here to your ultrafiltrate as part of your filter na glucose. Okay, so pagdating dun sa proximal convoluted tubules, remember here that your renal threshold only for the glucose is up to 180 mg per dl. And therefore, much of the glucose more than that would eventually be overflowing your urine. And if you try to test for the urine of the patient, you have here your increased glucose level even in your urine and even your blood that will be associated here with your diabetic glycosuria. Okay, another one, we have here your gestational diabetes. Okay, gestational diabetes here usually occurring on the third trimester pregnancy. And this is characterized here by hormonal imbalance, which allows accumulation of your blood glucose into the placenta where you have your baby. And the glucose could be able to cross the placenta, but the insulin is not capable of crossing the placenta. And therefore, that results here to accumulation much of your glucose in the placenta, and the baby become obese. And later on, the baby after birth here would have the tendency to develop here the type 2 diabetes. But hindi lahat na magkaroon ng gestational diabetes would have here, later on, mag-develop din siya ng diabetes. It might develop, it might not. Okay, another one, mechanism here of your increased blood glucose would eventually attributed here to your non-diabetic glycosuria. Increased blood glucose is because of the increased production of the different hormones which try to increase your blood glucose. Again, your glucagon is produced by your alpha cells of your islets of Langerhans of your pancreas. So increased glucagon production in the case of your pancreatitis or pancreatic cancer would tend to increase your blood glucose. Cortisol is being produced by adrenal cortex, and Cushing syndrome here characterized by increased cortisol level. Epinephrine is produced by adrenal medulla, and increased level of epinephrine results to your pheochromocytoma. Growth hormone, on the other hand, produced by anterior pituitary gland, increased level of your growth hormone result to your acromegaly. And increased thyroid hormone here, T3 and T4, the thyroxine, would eventually result here, or hyperthyroidism, would have increased your thyroid hormones, and all this one tend to increase your glucose level. Since they are found here in a very high level expect here that the blood glucose will also be increased. And therefore, sobrang dami ang glucose sa blood, pagdating sa proximal convoluted tubule, hindi niya kaya lahat i-reabsorb. And therefore, mag-overflow pa din sa urine natin ang glucose and still have here the result of the positive urine glucose. Okay, another condition here that results to your positive urine glucose related to your renal glycosuria. In the renal glycosuria, the problem with that is only the tubular reabsorption. Okay, but the blood glucose is normal. However, here, kahit less than 160 mg per dl ang blood glucose sa patient, pagdating sa ating proximal convoluted tubule, since may problem siya sa tubular reabsorption, it could not reabsorb the glucose. And therefore, bababa pa rin siya or mag-exit pa rin siya part of your urine as part of the urine ng ating glucose. And therefore, the patient would have here the positive urine glucose, but the blood of the patient here would have a normal na blood glucose. Ang problem dito is not the overflow, but rather on the tubular reabsorption. Then we have here your Fanconi syndrome. Again, Fanconi syndrome is your generalized tubular defects wherein it affects not only the reabsorption of your protein, but as well reabsorption of glucose or even some other ions. Then we have your renal disease related to your problem with your renal, with your tubular reabsorption. Osteomalacia is with the increased calcium level, and we have your related to some pregnancy. Okay, then we have here the test strip method here for your glucose testing. So the test pad for your glucose strip here make use of the principle of the double sequential enzymatic reactions. It's a double sequential because this one is a two-way reaction process. In the first reaction, your glucose. So notice here that your reagent test pad is only specific for the glucose. It will not test for the presence of your other sugar. Only that this one will give a positive result if what is present na sugar sa urine patient is only the glucose. So the first reaction again, glucose plus your oxygen catalyzed by your glucose oxidase. This is an oxidation. Okay, this is a reduction process. Okay, glucose oxidase, try to reduce your glucose to your gluconic acid plus your hydrogen peroxide. Hydrogen peroxide plus your chromogen. So, pag sinabing chromogen, this is your indicator responsible here for the color change. The chromogen, pwede kang gumamit ng potassium iodide. Potassium iodide will change the color here from green to brown in color. So, green is negative, the brown is the positive color reaction. Another chromogen na pwede natin gamitin, we have your tetramethylbenzidine. That will change the color here from your yellow to green. Yellow is negative, then green is the positive reaction. If your test pad, tetramethylbenzidine ang kanyang chromogen. Then we have here your peroxidase, try to oxidize your chromogen to become here your oxidized chromogen, which is the colored end product. Okay, now we go to the different interfering substance that could try to affect the results here. So, of your test pad for your glucose. The first one we have here, the false positive result may be encountered here in the presence of your other oxidizing agents. On the other hand, the false negative will be on the presence of your reducing agents. Like for example, we have your ascorbic acid, high specific gravity, low temperature would try to eventually try to reduce the sensitivity of your tests. And of course, here the unpreserved na specimen. So because unpreserved specimen here, remember that when your urine sample is not preserved, it would result here to your glycolysis and therefore it would decrease the glucose level natin because of the continued consumption of our RBC with our glucose level. That's why you need to examine and analyze your specimen immediately as possible. Okay, so we have here the reporting of the result here for your color reaction. So it's based on the color reaction changes here. So reporting could be negative, trace, 1+, 2+, 3+, 4+. For the sensitivity of your test here for the test pad, for your glucose here, so it will be able to give a positive result if the glucose concentration would be more than 100 mg per dl. So pag less than 100 mg per dl, expect to have negative results. And again, test pad for the glucose will only identify the presence of your glucose lang. It will not detect other sugar. Okay, another test here for your glucose determination would be the copper reduction method. The copper reduction method is based on the ability of your reducing substances. We have several reducing substances. Not only your glucose here, but all the other sugars like your lactose or galactose, your maltose or pentose, and even your ascorbic acid. And another one is your drug na cephalosporin is also considered here as our reducing agent. So mean to say the presence of all of this one will give a positive result with your copper reduction. So, pag nag-positive result tayo sa copper reduction, hindi natin alam kung ano ang present sa mga ito. But unlike in your test pad for the glucosuria, your reagent strip, pag nag-positive siya, it will signify na what's really present will be the glucose because very specific ito sa glucose natin. Okay, so based on the principle of your copper reductions, based on ability of your reducing sugar here to reduce your copric oxide to your cuprous oxide. That would change the color of your reagents. So example of the test, we try to utilize the principle of your copper reduction. First one, we have your Benedict's test. So Benedict's test make use of your Benedict solution, which is the blue color na solution. It contains the following reagents: copper sulfate as a source of your copric oxide, sodium citrate, and we have also your sodium carbonate. Okay, so color changes here depending on the concentration of your reducing substance. So it will change the color here from blue to green to yellow, orange, and red. So ito yung sobrang taas na concentration depending on the concentration of your reducing substance present in your sample. Another test, we try to utilize here your copper reduction principle. We have your Clinitest tablet. This is a tablet test. Okay, so reagent incorporated in your Clinitest tablet. We have your copper sulfate, sodium citrate, sodium carbonate, plus your sodium hydroxide. The sensitivity of this one will also have here, okay, more than 200 mg per dl. So mean to say, in order for you to have the positive result here with your copper reduction Clinitest tablet, dapat ang present nating reducing substance in your sample should be at least here 200 mg per dl. So less than that, it will give a negative results. Unlike in your test pad for the glucose, ang sensitivity natin is only 100 mg per dl. The positive result here for your Clinitest tablet is still the same as this one. It will change here the color from blue to green to yellow to orange to red as your concentration of your substance try to increase. Okay, then we have here the procedure for your Clinitest. So just have here 5 drops of the urine, then you add 10 drops of your distilled water, then just drop 1 tablet of your Clinitest. And then try to observe here for the color change. But you need to be observant here for the presence of your pass-through phenomenon. So pass-through phenomenon here, condition wherein the color reaction here, try to revert back to the original color. Like, diba, ang positive natin ay, ano nga ulit? From blue, green, orange, blue, green, yellow, orange, red. So yun ang red ang pinakamataas dapat na concentration ng ating reducing substance. However, in the case of the pass-through, pag after na-reach na ang red na color, bumalik siya ulit sa blue-green para mag-negative na siya ulit. So this is because of you have your very high concentration of your reducing substance in your sample. To prevent the pass-through phenomenon here, so gagamit ka ng 2 drops of the urine instead of your 5 drops. Okay, that's to reduce here much of the concentration of your substance. Okay, now we have here the correlation between the results of your glucose oxidase. This is your test pad, your agent strip versus your Clinitest tablet. So again, glucose oxidase test in your test pad is only specific for your glucose. Okay, your Clinitest tablet would eventually be positive here for all reducing substance, including your glucose. But not only your glucose, plus your other reducing substance. So 1 plus dito, negative dito, so that will signify a very small concentration lang ng glucose kasi this is of course specific for the glucose. 4 plus, negative dito. Usually dito kung glucose ito pati dapat dito mag-positive. Since nag-negative siya dito, it will signify that you have your oxidizing agent, which is your interfering substance. It's possible here for the false positive result here. Another one, glucose oxidase negative. So it would mean na hindi ito glucose ang present. The positive sa Clinitest mean to say, ang present sa sample natin is not glucose kasi negative siya dito, but rather what's being present on that is any of those reducing substances except your glucose. Okay, thank you.